With Mid-Georgia Ambulance, we're going to talk about cardiovascular disease, and it always seems like this topic comes around when we talk about Valentine's Day because everybody's got the heart on their mind.
Absolutely. Well, if you can see, I've got a model here just to give you a quick idea of how it works. Blood's going to enter the heart to this right side, pumps it to the bottom, and it goes to the lungs. Now, from there, it gets its oxygen, comes in back into this side, and is pumped from here to the rest of the body. But before it goes anywhere, it comes right back to the heart. It's kind of greedy that way. You see all the arteries and veins?
Yeah, that's fascinating.
And we've been talking about the heart attacks. If these veins ever get blocked and the heart doesn't get oxygen, that's how it gets its heart attack.
Any one of these little veins could cause a problem.
Absolutely. And but really we're focusing more on heart disease, not just heart attacks this month. There are several lifestyle factors that increase your risk of heart attack. Things like smoking, eating greasy foods, lack of exercise, obesity, diabetes even. But I really want to focus on high blood pressure.
Okay.
I'm literally on a daily basis when I'm in work, I'm seeing about 6 out of 10 patients have high blood pressure.
When you go out on these calls.
Absolutely.
Runs, yeah.
And it's not so much a bad thing to have high blood pressure as long as you're taking medicine properly. But a lot of people aren't able to take their blood pressure medicine daily as they should, financial reasons or whatever it is. Now, let's say you're taking your high blood pressure medicine, you're taking it regularly, and your blood pressure comes down low. And you're used to that, and all of a sudden you stop taking it for whatever reason, your blood pressure jumps up again. That's tough on you. Literally, I don't know if too many people know how blood pressure works, but there's a top number and a bottom number. Top number is your systolic blood pressure, and that's how much pressure is in your blood and your arteries when the blood is literally the heart is squeezing and pushing it out. And the bottom number is your diastolic, how much pressure is there when it's resting. So if your blood pressure goes up, and let's say this bottom number is really high, that means even when your heart's trying to relax and take a break, it can't. And it's got as much pressure as it should be when it's doing work.
So it's kind of gasping for air. I mean,
Pretty
that
much.
Organ is like, hey, help me out.
Absolutely. And when it gets to that point, there's all this pressure. Literally, if you have already heart disease problems and your veins are weak, they can even burst or get occluded or whatever. And so then you have a heart attack on your hands. So there's a lot of factors that literally take place, and we really need to focus on taking medicine appropriately as the doctor prescribes, exercising, put down those cigarettes. There's a lot of things you have to do to keep your heart healthy, and we really need to try and focus on it.
All right, Andrew, it would be nice if you start going out on calls and blood pressure takes a dive and we don't have as many folks suffering with that.
Absolutely. That would really make me smile.
All right, thanks so much. Well, your mom probably told you not to play with your food. Did your mom say that to you?
She actually did a whole lot.